From MTN, the Montana Television Network, this is Face the State.
Good morning and welcome to another edition of Face the State on the Montana Television Network. I'm Mike Dennison, MTN's chief political reporter. My usual co-host is here as well, MTN political analyst and Montana State political science professor David Parker. As you probably know, Election Day is just 3 weeks away, and absentee ballots have already been mailed to tens of thousands of Montana voters. And one of the top items voters will be deciding is Initiative 185, the ballot measure that makes permanent Montana's Medicaid expansion program and raises state tobacco taxes to help pay for the state's share of the cost of this program. Already more than $17 million has been raised and spent on the campaign for and against I-185, making it the second most expensive campaign in the state this year. Today, we're going to drill down on I-185, take a closer look at its contents, and examine the claims by both campaigns. To help us do that, we have two guests. State Representative Nancy Ballance, a Republican from Hamilton, who is opposing I-185, and Jesse Laslovich, who represents several Montana hospitals, supporting the initiative. Welcome to the show, both of you.
Thank you.
We're going to start out with Jesse. Medicaid expansion. I don't think that everyone in Montana probably knows exactly what it is. Let's talk about what is Medicaid expansion, who's it covering, how is it paid for, where's the money going?
Yeah, so Medicaid expansion was passed barely really by the legislature in 2015, but it was a bipartisan result led by Senator Buttrey out of Great Falls that expanded the eligibility for folks. A Republican, correct. To expanded the eligibility of folks to receive Medicaid benefits. So under traditional Medicaid, it's up to 50% of the federal poverty level. Under Medicaid expansion, it's up to 138% of the federal poverty level. And for context, for a family of four, that's approximately $34,000. Traditional Medicaid has some factors that restrict it, whereas Medicaid expansion is more expansive. You can be a childless adult with no children who can qualify for Medicaid expansion. Look, it's brought $500 million into the state. It has saved the state in spending $50 million. It's created 5,000 new jobs. It's with those jobs, $270 million in personal income. And I think it's irrefutable in terms of the bankruptcies that it has reduced. It's been a lifeline to our rural hospitals that so many people in this state rely on improved credit scores. So it's something we're proud that Montana passed it in 2015 and why we think that we need to extend it through 185.
And just to be clear, it's covering adults who don't have children, whereas traditional Medicaid, as you said, covers other types of people, low-income people. And right now, Medicaid expansion is covering about 97,000 people in the state, correct?
That's correct,
okay.
Up to almost 100,000 people, 1 in 10 people in the state.
Okay.
And we're talking here in terms of poverty level, 130% up above that. So about what type of household income are we talking about here?
For a family of four, it's approximately $34,000. So, I mean, we're truly talking about the working poor here. I mean, you have from the Help Oversight Committee, so the Oversight Committee is providing oversight on Medicaid expansion just came out, 9 in 10 are actually between 0 and 50% of the federal poverty level. So we're talking a much smaller number than even the $34,000 annually in household income for a family of four.
Now, Nancy, when the bill came before you in the legislature in 2015, and you voted no to expand the Medicaid, could you tell us a little bit why you didn't like that particular expansion?
Sure. At the time, we had seen it also in 2013. Mm-hmm. We had had a fair amount of time to study it. We were looking at other kinds of alternatives that would have been more targeted very specifically to the people who had disabilities, not just people who were in poverty, but specifically people who had disabilities or low-income parents with kids or veterans. This was a little too wide open. It was made available to able-bodied adults, people without disabilities, and people who were of working age without children. And it was very difficult to understand what that population was. We were trying to identify how many people within the state of Montana that would cover, and that was a very difficult number to get to. Estimate was made of 45,000. As you can see, we've doubled that. So I think the real issue here is, have we created, and we were wondering at the time, are we creating a permanent entitlement whereby people will not have that incentive to raise out of poverty and move on? And what we still don't know is that number of people, are they permanent, or are they 100,000 people who have some churn? Some come on the system, some come off, and we still don't know the answer to that.
Now, when that bill passed in the legislature put in a sunset date, and that sunset date is this coming June, unless the initiative passed. So why was the sunset put into law in the first place, do you think?
Sure. First of all, it was probably the only way it could have passed. I think that there were enough people that were nervous about how many people would actually go on the system, what the cost was going to be, and what limits we're going to put on. So if you remember the original HELP Act, the Medicaid expansion had work requirements included. It had some asset tests included, and we didn't know at that time what was going to be approved by the federal Centers for Medicaid Services. So since that time, we found that we were not able to implement those the way they were expected.
Now, Jesse, of course, we talked about people in the legislature put that sunset on there because they perhaps wanted to review it in 4 years. The supporters of Medicaid expansion, including you and your hospitals, decided to use the initiative process to ask voters to extend it rather than the legislature. Why?
Yeah, it's a great question. So we tried actually to negotiate with some key legislators, Representative Balance's colleagues, and were unable to come up with an agreement that could be introduced and have bipartisan support in the legislature to extend it. Yes. And so there were those efforts, and I think it's indicative of where we are and where the legislature is and where it will be. I mean, it barely got by in 2015, and what that looks like in 2019, despite the data being there about it being still, instead of almost 100,000 Montanans, ratcheting that down to 50,000 perhaps, or 25,000, and what that means for those folks who then will no longer be on Medicaid expansion, and then correspondingly to the access to care and the hospitals, what they'll have to incur in charity care. Look, this, to Representative Balance's, to counter Representative Balance's point about the working folks, under Medicaid expansion, there's been a 9% increase on able-bodied adults into the workforce. For disabled folks, it's been a 6% increase. This came from the Bureau of Business and Economic Research, an independent study. So it has worked and served the purpose of not only providing health coverage to people, but getting them into the workforce and be productive citizens.
So essentially, you felt you wanted to go directly to the voters because you didn't feel the legislature, you weren't sure if they were going to extend it. Now, we're going to talk a little more about the contents of I-185 in a minute, but first, we're going to watch some competing ads on the subject. First, we're going to show you an ad from the opponents of I-185, and then next, an ad from the supporters featuring Governor Bullock. Here's the ads.
What are the facts about Initiative 185? 185 is a massive new tax increase that deceptively claims to fund Medicaid expansion, but doesn't provide enough new revenues to pay for it. It raises new tax revenues, but sends more than half to the general fund and existing programs. So instead of fully funding Medicaid expansion, it creates a permanent unfunded mandate of $34 million a year that you'll have to pay for. Vote no on 185.
Big tobacco corporations are spending millions of out-of-state dollars, misleading Montanans about efforts to protect our health care. Here's the truth. The I-185 ballot initiative fully funds health care for 100,000 of our fellow Montanans. It provides services to seniors and veterans that they've earned and deserve. And it saves Montana taxpayers money. It's time to hold Big Tobacco accountable. Join me in voting yes on I-185. It's the right thing to do.
So Nancy, is Governor Bullock correct? Are opponents of 185 misleading Montanans? Does 185 fully fund the Medicaid expansion?
185 does not fully fund Medicaid expansion, and it clearly states, if you look at the fiscal note that was associated with it, it makes it very clear that the cost is about $60 million a year, and what is actually being funded is about $26 million. So that leaves a $34 million hole. Now, I know that there are arguments that say you can fill that hole other ways, but the very definition of an unfunded mandate is it's something that you have to do, which the law will say we have to do, Medicaid expansion, and yet the money to pay for it does not cover it.
Let's take that $34 million and put a little bit of perspective for viewers. You serve in appropriations, so what percentage of that would be out of the entire state budget? $34 million hole.
Oh my gosh, it's a small percentage, actually, a fairly small percentage. So if you look at general fund money, for example, you're talking about $5 million roughly. So it is a small percentage, and yet if you think about university funding, for example, they may come and ask for another $20 million or so. So it would cover that. You think of other initiatives that have to be funded, school funding, for example. There are several initiatives that come forward on school funding that would easily use that and more. So
would it be fair to basically characterize part of the reason that you might oppose it is that you feel it kind of hems in the legislature's options a little bit?
Well, I think that's true, but I think there's a more important factor, and that is the fact that if you're a citizen sitting at home thinking about this, you know, should I support this or not, you may have 6 weeks or so to study the issue. We've been studying it for 6 years in the legislature and trying to understand it in depth. This is the legislature's job, is to understand these things in depth, know where the trade-offs are, know where the spending might step on another initiative like education or corrections or infrastructure, and that's the job.
So Jesse, you've seen the ads against it. You've heard what Nancy has said, and they all focus pretty much on this $34 million unfunded mandate. Is it an unfunded mandate or not?
No, it's not. Look, these multinational tobacco corporations are lying yet again about unfunded mandates to protect their profits. It's very simple. Representative Balance mentioned the fiscal note. She's right about the $26 million. She's right about the approximately $60 million. What she's not telling you is annually we get about $5 million in premiums from people that are on Medicaid expansion that they have to pay pursuant to the state law, and nor is she telling you the $29 million that we're getting in state savings due to the state federal match being more favorable. That's $34 million. It's funded, and on top of that, we have all these other programs that we're funding, including veteran services, veteran nursing homes, that allow the elderly and the disabled to live independently and stay in their homes. The true unfunded mandate here, Mike and David, is the big tobacco corporations, tobacco-related diseases are costing Montana annually in healthcare costs $440 million. They're costing taxpayers per household almost $800 in taxes annually. We're suffering at the hands of the tobacco companies. The folks who are supporting 185 are in the business of saving lives, and these folks are taking those lives away. So who do you believe, health organizations or tobacco companies that have lied to us?
We'll come back to the contents of the bill just in a little bit, but you mentioned about the savings, the $28 million in savings. So you're saying that we have to spend $60 million to save $28 million. Why not just not spend the $60 million? Don't we just save the money then?
No, because the folks, there's dual eligibility. The folks who are eligible for Medicaid, they're also eligible for Medicaid expansion. We're going to be spending that money anyway. And that's the irony to all this. In the fiscal note that Representative Balance mentions, it says specifically cost avoidance, $29 million. So again, the folks who put this together are smart people. They care about the health and welfare of the people of this state and don't want to saddle the general taxpayers. The general taxpayers are already being saddled with tobacco-related diseases.
So that was the desire. Why are all these different programs being funded by the initiative? I mean, we have about 6, 7, 8 of them being earmarked out in various ways. Why not just say, okay, this is going to pay for Medicaid expansion, and we're going to pay for the entire $60 million or whatever it takes, and whatever's left over can go to these other programs.
So
why do we split it all up like this?
So there are existing programs that are already receiving money from the current cigarette tax revenues that are being brought in. So those programs, like the Veterans Nursing Homes, like Tribes, like our long-range building program for infrastructure, they're receiving
Medicaid
money.
programs.
So that should continue. And then the additional money that we're providing necessarily should be tied to those and the tobacco tax revenue that we would be brought in. This is not something new. It's already being done.
Nancy, the biggest concern I have as a voter here in the state and as a citizen of the state is I look at the amount of money being pumped into the state. It looks like Mike said $17 million total, all sides. That's more than the governor's race was in on the campaign in 2016. And on the side that's opposing, all that money is indeed tobacco money. Why should I trust a campaign that's being supported by tobacco groups which have lied to the public in the past about the health effects of their product?
Sure, but I would like to address, if I may, the unfunded mandate, because
Sure.
I think it's important. The $29 million that Jesse talked about is not a savings, it's a cost avoidance, which is very different. So that would say it only is effective, it becomes a cost if we don't fund Medicaid expansion at all, which was not the legislature's intent. The legislature's intent was to make reforms to that system and make it better than it currently is, and make sure that the people who are receiving benefits are truly the ones who need it. So it's a cost avoidance, which is very, very different than an actual savings. So I'll leave it at that. To your question, yes, we call them citizens initiatives, but the citizens don't pay for them. We have big corporations on both sides of this issue. We have the hospital corporations who funded the initiative initially and are continuing to fund it. And then we have big tobacco on the other side who's fighting the initiative. These are big corporations that reap the benefits. Citizens, yes, the state also reaps benefits from this, but make no mistake, the campaigns are funded by big corporations on both sides.
And to be clear, if I can jump in here, it's an unfair comparison to talk about hospitals and physicians and nurses, the American Cancer Society, the American Heart Association, Montana AERP, all of whom are supporting 185, and billion-dollar tobacco corporations. It's not coincidental that you're seeing these ads on the airwaves. They're able to saturate the market because they have the $1 billion in profits. Hospitals don't have that. American Cancer Society doesn't have that. So again, we want the folks who are watching to know that this truly is big tobacco versus a diverse coalition of public health organizations.
We'll come back to that in a second, but before we do, one thing I want to ask you about the decision to tax smokers and tax tobacco users. I think we can all agree that probably the majority of people who are smoking are probably not well off. So we're going to tax addicted people who are poor to pay for this program. Does that seem like the right thing to do to you?
Look, Mike, the fact is the cost of tobacco-related diseases to all of us is substantial. $440 million annually that we pay in extra health care costs due to tobacco-related diseases. Montana businesses pay over $1 million, or lose over $1 million every day due to less work productivity because of tobacco-related diseases. So we know, based on science, there is a health impact to tobacco use. And so the irony of the argument of all general taxpayers are going to be on the hook if I-185 passes. We already are on the hook due to big tobacco. So we think it's entirely appropriate, and it has precedence. The voters in Montana in 2004 passed a tobacco tax initiative. We've tried to pass tobacco tax increases through the legislature. The legislature as recently as last session has rejected it. Over 26,000 Montanans, and finally this initiative said enough's enough. We want to take it to the people again to see if they'll pass another tobacco tax increase because we're tired of subsidizing tobacco companies' profits.
And Nancy also mentioned the hospitals. Of course, $12 million has been spent through the end of September by the tobacco companies on the campaign. The other side is about $5 million, and I think $4 million of that is pretty much from hospitals, MHA and other hospitals. Now, they must be benefiting from this quite a bit in terms of revenue. What about the rest of us? Why haven't we seen, or are we going to see lower prices from hospitals because the hospitals are getting all this money through Medicaid expansion?
Well, I'll tell you what you will see is if it fails, and this comes from the Bureau of Business and Economic Research, if it fails, we're all going to be paying an increase in premiums to the tune of between 4 and 7%. And I will tell you also, hospitals will incur additional charity care that we're all going to pay for. We're all in this together, and you're right, Mike. It's a big amount of money to hospitals if Medicaid expansion goes away, but we're relying on these hospitals to take care of folks regardless of their health condition. They have to take care of them coming into the emergency rooms throughout the state, and whose mission is to take care particularly of the poor and vulnerable, and that's this population. So again, I hearken back to, I think it's appropriate for hospitals to be engaged in this in a big way, and they are, because of the impacts of tobacco-related diseases throughout the state.
I'm still struggling, Nancy, with this idea that, yeah, we have corporate forces on both sides putting money in. At the end of the day, a hospital, their job is to help me get better and make me healthy, where tobacco, that has a negative consequence. So why would tobacco companies want to put all this money into this initiative to defeat it? And why should I trust anything that's being said in those ads, given the fact that money comes from a product that causes cancer?
Well, again, I will say you have big corporations on both sides, and you can argue whether one corporation is a public benefit and the other may not be, but the reality is these are big corporations. These are not citizens who are funding this, and make it clear it's not the money from the nurses and the doctors and the small amounts they put in, or on the other side, the small amounts of money that are put in by citizens. This is big corporations funding it, and it is huge dollars. And I would like to address one other thing, which is Jesse painted a very dire picture if this were to fail, meaning if I-185 were to fail. That assumes that the legislature does nothing. It is not the legislature's intent to do nothing. We have now almost 100 million people on Medicaid expansion. It is not the legislature's intent to simply turn our back on those 100,000 people, but it is our intent to make significant changes to the underlying policy such that we qualify the right people, that there are work requirements, that there are true asset tests, and secondly, that we put the right metrics and measures on this system to see, are we really bringing down the cost of health care? We make a lot of promises about what tobacco cessation is going to do, but tobacco cessation we've put a ton of money into in the state of Montana, and we're not seeing the results. So
you're saying that if it were to fail, and this is kind of my next question for you, but you answered already a little bit. If it were to fail, the legislature is probably going to take a look at this and perhaps put some additional restrictions and tighten it up a bit and direct it more at certain people rather than just having it be wide open now, as you say. Is that correct?
Absolutely. Medicaid expansion has a test on income. We don't believe it's right that someone who may be retired and has a very small income but has a couple $1 million in the bank should be receiving Medicaid benefits. And I think that's, Montanans agree across the state. We also think it's important that people who are receiving these benefits that are able-bodied adults without disabilities, it's reasonable to assume that they should work some amount of time either at an actual job or community service or something in return for the benefits.
And can I just jump in here?
Sure.
To be clear, we agree. I mean, we're not talking about millionaires who are on Medicaid expansion. 9 out of 10 of the folks who are on Medicaid expansion are at or below 50% of the federal poverty level, which is about $26,000 annually for a household of 4 per year. That's who we're talking about here. So we're more than willing to work with the legislature, even if it passes, even if, of course, if it fails, on reforms. But what we're not willing to do is say to those approximately 100,000 Montanans, most of whom are not making a lot of money, that you're on your own when it comes to health care.
That kind of goes to my next question as well, which I'll ask of both of you. If it does pass, what can or can't the legislature do? And my presumption is that the legislature can do anything it wants. I mean, it's a law, it's on the books. You can go in and you can make some fixes, make some changes. I'm wondering if you think the supporters would be amenable to that, because the governor could easily veto those changes if he wants to. I was wondering, first, Jesse, what do you think the supporters would be willing to do or willing to talk about in terms of some changes in the program if this passes?
Yeah, we've been clear about that. The supporters went to some of the legislative leadership last spring to see if we could work out a solution. And I think even if it does pass, we're still willing to go to the legislature and try to figure out what needs to be improved. Will we disagree on things? You bet. Will we agree on things? You bet. But we're all in this together. What's unacceptable to the supporters is this idea that Medicaid expansion should go away or should be significantly reduced to 25 or 50,000 when approximately 90,000 are at or below the federal poverty level as it is. So, I mean, there's always been a willingness to work with the legislature. The faith, however, based on past legislatures, particularly in the 2015 legislature, is it was moving mountains just to get a bipartisan legislative solution passed with Medicaid expansion. And if our discussions are any indication this spring, it's still going to be hard to get something passed, including some of these reforms that Representative Ballance is talking about.
Nancy, what about you? If this passes, do you think the legislature has the power to be able to do a few things that it would like to do to adjust it?
I think the legislature has the power to do that. I will say, though, that the governor has not shown an interest in going beyond the current Medicaid program to implement some of these reforms that we have talked about.
And he'd have to agree.
Our big concern is that he would have to agree. And I think the other thing that there's a major point that we're missing here, and that is we talk about 100,000 people on Medicaid expansion because they're below the federal poverty level of 138%. We had about 200,000 people on traditional Medicaid because they were disabled or in poverty. In my opinion, that's a state tragedy, that we have as many people as we do in poverty and requiring this system. And I think that's what we ought to be focusing on as well.
So if I can just jump in here, I agree with Representative Ballance about it being a state tragedy. A bigger tragedy, in my opinion, is the billions of dollars that these large tobacco companies have made, not only on the backs of Montanans, but on the backs of Americans. It's unacceptable. We can stand up to them by passing I-185.
We're at the very end, so very quick. Medicaid expansion, do you think it has been a good thing in the state, generally speaking?
I think generally speaking, it has provided benefits that people did not have. It's certainly been a benefit for hospitals. But I think it's important to note, too, that hospitals cannot survive on Medicaid rates. I believe we'll be back here 2 years from now saying we need more money.
So it sounds to me, at the very least, whatever happens, it looks like there's some will to try to resolve this issue, regardless of whether you're a Republican or a Democrat, which I take as I think that's good. So,
I think it's good, too.
Yeah.
I think that about wraps up our discussion today on I-185. I hope everyone goes to the polls or votes absentee on this very important issue before the state. David and I will be back in 2 weeks to discuss another big initiative on the ballot, Initiative 186, which has to do with mining and clean water. So 2 weeks, we'll be back again. I'd like to thank our guests as well. Thank you, Jesse. Thank you, Nancy, for joining us this morning on Face the State.
Thanks for having us. Thank you.
You've been watching Face the State, a presentation of MTN, the Montana Television Network.